Hi Matt, how are you?
Hi, I'm great, thanks. How are you?
Yes, I'm not bad, thank you. So you are the business development manager at Patient Plan Direct, and I think I've been told that you're quite new at the company, so you're a new addition.
Yeah.
Tell us a little bit about your journey there and your background in dentistry.
Okay, so my career started in the wider healthcare setting, so I'm not always from dentistry. I initially came into dentistry and I ran a very successful private practice with a large planned patient base. And then I went to work for another of the major plan providers, and I was with them for sort of 3 or 4 years. And then I came away from plan during the pandemic. I went back into practice, and I managed another large site for just over 12 months. And now I've joined Patient Plan Direct to come back into the plan arena.
What made you come back? You just couldn't resist.
Yeah, so I think plan is what I'm passionate about. So it's what I
Uh-huh.
love, it's what I know, it's where even from the very start of my career in dentistry, plan has been a major factor in the success of the businesses that I've run, or the people that I've
Okay.
been supporting. So I think it was just a natural pull that actually I stepped away from the plan arena, and I think sometimes you don't realize what you enjoy until you really do step away from it. And I think, yeah, plan was always where I'm meant to be.
Yeah, no, that's true. I think, yeah, sometimes when you're in that environment, you don't quite realise how much you're enjoying it until you pull yourself away from it and you think, actually, that's the place for me. So you're a PPD,
Yeah.
and obviously it's quite a, I guess, I don't really know what word I'm trying to use here, but it's quite a contentious time at the moment in dentistry. There's a lot of people moving away from the NHS. There's a lot of dentists and dental practices who aren't really getting from the NHS what they perhaps thought they might when they first delivered NHS dentistry, and they're making that shift across to the private world. So, I mean, how would you summarise these key pressure points that are affecting the profession at the moment?
So I think the obvious one to the profession and to the general public is that demand way outstrips supply. So there just isn't, it doesn't matter how many hours a day a dentist works, they're never ever going to achieve looking after their whole community, because there's just far too many people trying to access a service that is under significant pressure. I think the pandemic has added to that, because actually dentists probably had regular patients pre-pandemic that they saw on a regular basis. They were well maintained. Now some of these patients have gone 2.5 years where they haven't been seen, and so a well-maintained NHS list that was easy to look after is now full of high needs patients needing multiple restorations. And so all of a sudden they're trying to really find this balance with, how do I keep looking after my patients and deliver this enormous amount of treatment that's come out of having that period of lockdown, and then the reduced activity over the last sort of 2 years. I think the NHS really hasn't helped themselves, because they've released those preparedness letters which have said, in order to get your financial security, you've got to take 111 referrals, you've got to see urgent cases, forget about registration, it doesn't exist. And we all know that registration didn't exist in dentistry, but it was common practice that practices had business lists, they had regular patients that came back, and actually telling a dentist to stop looking after your regular patients and prioritize people walking in off the street was never going to sit well with them, because ultimately they're dentists because they want to look after people. They don't just want to be firefighting problems with people who don't want to see them on a regular basis. So I think
That's true.
that's all added up, and it's now created a massive recruitment issue, that we were already under this pressure of principals struggling to find associates, and now we hear stories every week about associates leaving practice because they do not want to work within the NHS system, and if they can't get rid of the
Yeah.
NHS where they are, they'll happily go somewhere else into a practice that will offer them that opportunity. So I think you've got a group of dentists who are saying the pressure of the NHS, the disrespect we've had from them in terms of their last minute announcements to us across the pandemic, and the way they expect me to,
Yeah.
care for my patients isn't acceptable. They're looking to leave. And then we've got another group of principals who are saying, I would like to make the NHS work, but I can't, because I can't recruit to service it. So I've got to get rid of it, because it's the only way I can get dentists to come into my practice, is to offer them private only service. Yeah.
So what is it? that you guys are doing to alleviate these problems or help the people who are facing them?
So ultimately, a dental plan provider is the major support in wanting to leave the NHS, because there is a lot of financial security with an NHS contract. You know, a dentist knows that he's got some income coming into that building every month, every year. And if you were to just surrender that contract and hope that patients are just going to walk in over the threshold and pay cash over the counter, that's quite a big risk to take. So the dental plan mitigates that risk by saying you can now get patients to join a dental plan. They will give you fixed and predictable income each month, and that will help to replace some of that income that you're used to from the NHS, and then you'll deliver another part of it through your treatment delivery. So we do things in a couple of ways. So I guess practices go about converting when they talk to us. They have really two options. They go down what you call a partial or a principal-led conversion, and that might be that the practice wants to retain the NHS contract, or they want to retain a reduced proportion of it to service with associate dentists, but the principal dentist is saying, I'm going to go private only, I'm going to offer a dental plan to my patients. Now, that worked really well once upon a time, but the problem we're now seeing is that local area teams and local health boards in Wales are now not willing to negotiate on contract value or terms with practices. So I've had conversations with multiple dentists who have gone back to them to say, I'd like to hand back part of the contract, and the local area team are saying, well, no, you can either do everything or do nothing, but there isn't a negotiation to be had here. So that then puts people in a position where ultimately they have to consider what you call a full conversion, so they're going to have to surrender the whole contract. So, you know, to do that, there's quite a lot of background work, and the dentist needs some hand-holding, and that's what we're there to do. So we go through a whole viability assessment with the dentist. So we look at, is a conversion really a viable opportunity for them? Have they got enough patients to go at? Could a conversion be successful? What's it going to look like in terms of income replacement? So how much income can we replace with a plan income? And what does their prescribing technique for treatment need to look like as a private dentist in order to maintain the income that they're used to? You know, and how do we set a private fee list to make sure that the treatments are being charged appropriately? So there's all that surrounding work that has to be done, and that's what we're doing and what other providers will be doing when they're talking to dentists about converting away from the NHS.
So obviously there's quite a few other plan providers out there for dentists and for dental practices. So what is it that you deliver that perhaps gives you a slight edge, or you think is a particularly unique selling point within your company?
So I think, you know, Patient Plan Direct has always been known for its low admin fees. So, you know, that's always a great entry point, that actually we're going to help practices save money on their dental admin costs. So we're often 2 or 3 times lower in terms of our admin fees compared to the other major competitors in the market. Now, the other major competitors will charge a higher fee because they talk about offering wider service wrap, extra support on, you know, additional bells and whistles. So what I would always say to a dentist is consider, what do you really want from a plan provider? Because you might be led to believe that you need all these additional services, but are you going to end up paying a lot of money for something that you don't really utilize or access? So, you know, we're a great provider if you just want somebody who's focused on supporting you to leave the NHS, make sure that plan is super successful, and give you really personalised support. So the nice thing for PPD in comparison to the other major providers is we don't have a massive corporate entity sitting over the top of us. So we're not influenced by other arms of the business. We are a sole plan provider. That's all we do. You know, we're privately owned. We're a small team. We give a really personalised service, and we just stay focused to plan. So I think it's just considering, if you can get all that support at that lower cost from us, why would you really want to pay more, you know, to another provider? But at the same time, I would always say, when considering an NHS conversion, it is a massive, massive decision. And it's probably the biggest decision that dentist is going to make in their career. So go and talk to 2, 3, 4 providers out in the market. Have conversations with all of them, because, you know, ultimately what you're going to want to achieve, all of us can help you through. So for me, it's about making sure you feel that the provider is the right fit for your business, that you're going to get on with that person that you're going to work with, and you're going to be able to have really nice, honest, open conversation, because that's going to be really important to the success of that conversion.
Yeah, I bet that's very true. I can imagine the last couple of years and this year, I keep thinking this year's only just started, but it hasn't really, has it? We're almost halfway through it now. Exactly, I don't know where it's gone. I think I say that every year though. But it's a very busy time for plan providers, I can imagine, including yourselves. How has it been? Is that true? Has there been a lot of demand for your services?
Yeah, there's a massive demand for the service, and I think that demand is only going to increase. So I think, where you were having historically this steady trickle of people considering their options away from the NHS, actually what we've seen over the last couple of years is, because of all the problems we spoke about earlier, people, a larger number of the profession are now considering their options. And I think they have to look at what dentists are now looking at really is how do we ever go back to pre-pandemic activity levels, which is pretty much near as damn it what they've been asked to do from the 1st of April. That is a really high number of UDAs for a dentist to need to be delivering, and the way dentists made it work historically was they could get a nice number of checkups into an hour, and they could top up where they then needed to spend a couple of hours with a patient that was only going to generate 3 UDAs, for example. But now, if you've got this much bigger list of people needing extensive courses of treatment, trying to deliver that number of UDAs becomes virtually impossible for the average dentist, because they just don't have enough time, to be turning over, 20 or 30 UDAs in a day. It's just not possible. And so I think that has just really forced the hand of a lot of people to have those conversations. At the dentistry show last week, nearly everybody I spoke to, we were talking about converting away from the NHS and what would that look like and how quickly could they do it. And some people are at a point where they're just ready to pull the plug, and it needs to go as quickly as possible. Yeah,
I'm not surprised by that. I've had some conversations with practices and dentists and dental professionals who've echoed that. They've just it's sort of the final straw for them, I guess, when it comes to providing NHS dentistry, and they're just putting not only their livelihoods first, but also their mental health, because it's just taking its toll on their enjoyment of the job and how they feel in themselves, which is obviously a massive shame. So if that conversion is going to take that stress and that pressure off their shoulders, then it's definitely a fantastic thing.
I think that's a really good point to make, that working in the NHS has become more and more stressful over recent years, and like you say, the pressure on that person, because the dentist just doesn't have a work-life balance anymore. They feel like they're leaving work in the evening and they're going home worrying about the people that they treat. I've had conversations with dentists who have just said, I struggle to go to sleep at night because I worry about those patients that I know that I still need to do more for, but I just haven't got the time to do it. And that's just not a position that any dentist ever wants to find themselves in. And I think a conversion can reignite that passion for dentistry that the dentist has if they feel it's waning. They became a dentist for a reason, and that passion will still be there inside them somewhere. And actually leaving the NHS and getting yourself a nice, loyal patient base on an independent basis with the support of a dental plan will find you a nice work-life balance. You can still go on holiday and look after your patients, and it's really important that dentists know that opportunity is out there, and they just need to have that discussion, with us or somebody else.
Is there anything else that you'd like to mention that you think's relevant, or you think maybe my questions might have missed?
So from an NHS point, probably not. I think we've covered what are those pressures, what is it looking like, what we can do for the dentist. I think the only other thing really to mention as a plan provider is that I mentioned earlier our fees are often significantly lower than the other major players in the market. And so if you've already got a dental plan with another provider and you sat there thinking about how can I release a bit more cash into the practice, it's a really straightforward process now. So we use something that we refer to as simple switch. In banking terms, it's known as bulk transfer. Patients no longer have a call to action if you want to leave your current provider and work with another one. Historically, there was always this risk that you would lose patients because they had to fill in new direct debits. They don't need to do that anymore. We can do it all for you in the background. You know, there's no call to action for the patient. There's no additional work for the team. So you can release some extra cash into the building. And I think a really good way to look at that is that, you know, if you're working with another provider and we say to you, we can save you £10,000 a year by transferring to us. £10,000 is quite a lot of money, but it's not the end of the world. But when you convert that into treatment terms, if you say that actually treatment generates around 25% net profit for a practice, that's the equivalent of you as a dentist needing to deliver £40,000 of treatment a year to get that £10,000, and we can just give it to you by completing that transfer. So, you know, simple switches out there. If you want to save some money, you know, have a chat with us for sure.
Perfect. Well, thank you very much for joining me today, Matt. I really appreciate you.
No, thanks for having me.
Detailing the ins and outs of PPE and the current situation that dentists and dental professionals are facing. So, yeah, I mean, it's a very difficult time for many, but it sounds like you're on hand there to help people where it's needed.
Yeah, for sure. So, no, lovely to meet you. Speak to you soon.